Good afternoon, and thank you for joining us once again today for our daily COVID-19 update. I am joined today by the Director of Public Health, Dr. Sohail Bhatti. I will start by running through today's COVID statistics. As of this morning at 9 a.m., the total number of swabs taken so far was 2,174. There are 113 results pending, and the total results received to date is 2,061. We have a total of 1,859 negative test results, with 136 confirmed cases and 5 active cases, bringing both our confirmed and active cases 3 up from yesterday. We now have 131 recovered cases. I will now share our hospital statistics. In the last 24 hours, there have been a total of 22 attendances to accident and emergency, of which 3 had symptoms that could be related to COVID-19. There were no admissions to either COVID CCU or John Ward, which is our COVID ward, in the last 24 hours. Following the successful dry runs carried out this week at both St. Bernard's Hospital and the Nightingale facility, we will be undertaking a combined dry run next week, which will see both facilities working together in tandem. This will test the ability to coordinate the 2 separate sites and the transfer of patients between sites. Dry runs are critical to test our operational capacity and check the systems in place, which will allow us to avoid potential unexpected scenarios as far as possible should the need arise. These dry runs involve volunteers acting as make-believe patients, adding an element of realism to the scenarios. Yesterday, we received a further 20 hospital profiling beds for the Nightingale Hospital facility, which will replace 20 of the original beds which will be used should the need arise for any patient needing a bed of a more specialised nature during any potential hospital stay. At the beginning of the week, we received a further 2 top-of-the-range portable ventilators acquired directly from Dräger in Germany. These were kindly donated by Dr. Leif Goritz and his wife, Graciela Anthony. These are now deployed within our ICU. Thanks to Mr. Goritz's personal intervention, this ventilator and the second, donated by GVC Holdings, arrived in record time. We are hugely grateful for this kind donation. The GHA continues swabbing patients via our drive-through facility at Rook. So far, a total of 888 swabs have been taken by the drive-through facility, which continues being a very useful means to test the community and screen for COVID-19 in a safe environment. As of today, there have been over 4,900 calls received via the 111 service, and there have been over 1,500 submissions on the COVID-19 online symptom checker. A total of 352 swabs have already been processed via our in-house laboratory testing equipment since we started on the 9th of April. Our on-site equipment allows a quick turnaround of test results when medically indicated and necessary. We have received a total of 27 calls to our Outreach Family Centre service, which started last week. As already mentioned, this service allows families who may be finding lockdown difficult to cope with to call professionals and discuss their issues with them. This provides very helpful support. Simply by sharing one's experiences and problems, it helps to make these more bearable. This dedicated team is very well placed to provide advice and recognise when further advice may be necessary. The care agency continues looking after the needs of the most vulnerable within our community. I am pleased to announce that donations received to date have now surpassed the 1.63 million. We have had over 820 donors. We are most grateful to all those that have contributed so far. In order to provide a little break from the monotony of COVID, I would like to share with you today a beautiful statistic, and that is, since lockdown, we have welcomed 36 new lives into our community. 36 new babies have been born at St. Bernard's Hospital during this period. Yesterday morning, at our daily operational meeting, I was very pleased to learn that the maternity ward had had a very busy previous 24 hours with no less than 7 babies being delivered by our midwives to very proud parents. I wish them on behalf of the Government of Gibraltar and surely the whole community our most heartfelt congratulations and hope that COVID-19 will no longer be a reality when they come of age to reason and be merely another story to tell. Although these are difficult times, there are still many good news stories which often go unmentioned. A big thank you goes to the midwives and obstetric team for their great work. Over time, the scientific world is discovering new things related to the coronavirus which is responsible for COVID-19. As we learn more about this virus, public health advice changes in an attempt to keep our community safe. Government is taking very seriously all the updates from all the relevant scientists and health professionals, and especially those involved in public health worldwide and locally. We receive countless articles, scientific papers and news reports on a daily basis, providing us with useful updates in respect of outbreaks, scientific breakthroughs, and the position with regards to developments regarding possible treatments and even potential future vaccinations. There is more information out there than one could possibly ever read and digest, and the GHA and government are constantly reviewing and sharing literature to increase our knowledge and understanding of this pandemic. One thing that has been receiving a lot of attention in medical press recently, and is something very close to my heart, is that of obesity and its links to COVID. Being obese greatly increases the risk of complications associated with COVID-19. While we are spending more time at home, we need to look after ourselves and take care of what we eat. With grandchildren not coming around to visit, there is no need to have that chocolate and sweetie drawer, which we will eventually tuck into ourselves anyway. We should try to use our time positively while we are in lockdown to try to plan our diet, cook and eat healthier alternatives. We should perhaps try to eat more fruits and vegetables, choose lower fat alternatives to our milk and dairy products, and avoid sugary and sweet cakes and desserts. We should try to keep fried foods to a minimum, and perhaps now that we have more time on our hands, explore new low-fat, healthy recipes available online if possible. Those with blood pressure monitors at home can also check their blood pressure at least once a week to keep an eye on this very important health parameter. Try to do some exercise at home, even if it is simply stretching, touching your toes, or following the many exercise and stretching Pilates and yoga videos available online. For the fitter among us, there are very many motivating exercise classes available online too. This week, we have seen that there have not been any new cases of COVID-19, and it is easy to become complacent, and we may think that we may have beaten this threat. Nevertheless, COVID-19 is still circulating within our community, and today we have seen 3 new cases reported. We will shortly be carrying out more screening of frontline staff, which Dr. Bhatti will give you further details about later. As we cast out our nets, we will most probably discover more positives within the community. Building up this data is hugely important in our fight to keep the efforts or the effects of COVID at bay. COVID, if left unchecked, can and will cause us a great deal of harm if we do not keep our efforts up. Staying indoors has a very direct bearing on our civil liberties and cuts into the very fabric of our very outgoing culture and the way that we as a society thrive socially. We will be hugely sensitive of this as we map out any exit strategy and potential roadmaps for the future weeks. Our health should be and is of paramount importance to all of us. Once again, I must stress that our success as a community is down to all of you. For staying at home, for distancing yourself socially, by staying away from more vulnerable relatives, for observing the rules so well. We must continue to work together and keep up this great effort to ensure the safety of our loved ones and especially the most vulnerable within our community. We will slowly restore our community together and become once again the place we have all been used to. We will shortly be announcing a relaxation of rules and the elderly will be able to exercise outdoors once again. But this will still take time and a lot of patience, and we will always heed the advice of our public health and medical professionals. My heartfelt gratitude once again goes to Team GHA, Team ERS, and Team Care Agency for doing such a great job on the health front. Please remember to respect and continue to observe the COVID rules. Keep respecting social distancing. Please keep washing hands frequently for at least 20 seconds each time. Remember, catch it, bin it, kill it. Please remember, if you need medical advice, call 111. For any other questions, please call 200 41818. For GP consultations, call 2000 7910. For out-of-hours consultations, please call 200 77003. Finally, I would like to take this opportunity to announce that this coming Tuesday, the 28th of April, on Workers' Memorial Day, the GHA will be remembering and celebrating the lives of all those NHS healthcare workers that have lost their lives as a result of COVID-19. These people have been at the front line, and their vocational love for humanity and wanting to help care for others have seen them make that ultimate sacrifice for others. The GHA will be holding a 1-minute silence at the steps leading to St. Bernard's Hospital at 12 midday, while observing social distancing rules, to show our respect for these lives and give thought to their families on this day. Ambulances will be signalling the start and finish of the silence with the sirens. Dr. Sohail Bhatti will now give you further details about the work he is doing within public health. Thank you.
Thank you. Good afternoon. Before I start, I'd just like to acknowledge that as we live in such a diverse community full of many people from many religions, nationalities and languages, I find myself humbled when I'm often rushing between meetings, when people come to me and thank me for the work they're doing. I always feel guilty that I'm not able to linger, acknowledge the thanks and sort of mumble a thank you as I head away. I'm taking this opportunity to say thank you in return for all the hard work Gibraltarians have endured, because actually whilst I, as one person, can do so much, it is actually you and us as a whole community that has made a difference. I'd also like to point out that our Moroccan friends, neighbours, colleagues are suffering, actually enduring the first day of Ramadan today with fasting, and that is extra hard at this time. So I wish them all the best. Obviously, there are other people from other parts of the world, so Ramadan Kareem as well. I just want to remind ourselves that the symptoms of what COVID are, because it's been a little while since we've talked about them. Initially, we talked about the symptoms being the symptoms of a cold. And as we enter the hay fever season, a lot of the symptoms that people have in hay fever can be like a cold. But there are some substantial symptoms that actually indicate this might be COVID. And the main ones that we look for is a new cough. It's a cough that we've just developed with fatigue. That means being exceptionally tired. So tired you find it hard to get out of bed. Your muscles may ache. Sometimes, in about 3/4 of cases, there's a fever. One of the symptoms we ask for you to look out for is shortness of breath. By that, I mean that you find it difficult to complete a sentence just by doing a minimum amount of exertion. If that's unusual for you, I'm not saying that you've just run a mile and you're short of breath. I mean that actually, for you, normally, you might have been able to walk across the room, and now you're finding yourself short of breath. That's also another symptom. There's a number of other supplementary symptoms that we have some interest in, and certainly some of the local people have had. Headache Not headache on its own, but if you've got any of the other symptoms, that'd be helpful. Loss of taste or smell or appetite is also another sign. As I've said, a sore throat, and quite a significant proportion of the people also have loose motions. There seems to be a gastric element as well. So if any of you are suffering this collection or a combination of symptoms, please ring 111. We definitely want to know, because we want to make sure that anyone who's suffering from this virus is identified quickly, because we're moving over into a new phase of how we're going to manage this pandemic. I also want to point out, and thanks to the Minister for mentioning obesity, what we do know is that if you are ventilated, that you suffer disproportionately bad experiences, if not death, if you are overweight. Physically, it's really difficult to pump air in to your chest if you have a weight problem. I'd also suggest that there's now increasing evidence that if you have darker skin designed to keep the sunlight away, you're also lower in vitamin D, and that vitamin D directly impacts upon your immunity. And therefore, I would suggest, especially as we're spending a great deal of time indoors, that that may be one of the practical ways you may be able to boost your immunity. We are about to run a campaign, in fact, I think we've just launched it, called COVID Fit, which has been designed in association with and led by the teachers, and that is highlighting the damage and harm that smoking can cause. It makes sense that when we have a respiratory disease, that if you have damaged your lungs by exposing them to 3,000 different chemicals, and some of them are very nauseous indeed, that you will not do as well if you have this upper respiratory tract infection. What we want to move towards, as we have had low levels of the virus, is a much more nuanced approach, which will support our loosening that we anticipate will happen. We cannot just loosen everything. We have to do it in a very slow way. And as the Chief Minister has said, we gradually do it. We gradually reduce different elements of this particular lockdown that we have done, and we see and observe what damage, if at all, takes place as a result. And only by building confidence in these measures and building confidence in ourselves can we be sure that we are entering a territory where it will no longer, some of the suffering that we've had of self-isolation will go away. So what we're planning to do is we are, and we've looked at this quite hard, is that we would like to introduce some scanning, fever scanning. That's really about trying to give people some warning that they may have a fever. I've generally resisted fevers and fever scanning and masks, because at that stage in our particular strategy, it made little sense. We had vast numbers of people coming through over the frontier. Now that we don't, I think there is some merit in putting some protections. It's a layer of protection, and layer after layer of protection provides us with additional security. So fever scanning, I think, is important. The GHA today at the hospital has introduced it. We're getting some new machines to enable us to process things more efficiently. But the most important thing that you can do, apart from self-isolation, is the hand washing. I'm sorry it gets boring after a while and we keep going on about hand washing, but I cannot emphasize too much that hand washing is the best protection you have in this particular pandemic. And then I'll move on to the mask situation. We've reviewed this very carefully, and there still seems to be a mixed degree of evidence about the benefit of masks. But I think I've been persuaded, we've spoken to the World Health Organization advisors, we think that there's sufficient evidence now to suggest that because there's asymptomatic carriage, that means that people are carrying the virus, don't know they're carrying the virus, have perhaps no symptoms but are spreading it, that one of the best ways that we can prevent that is by wearing a mask. But I'm not talking about everybody wearing a mask all the time, everywhere. There is no evidence that anyone has caught the virus, or very little evidence, in fact, that anyone has caught the virus outdoors. So I'm not saying that people need to wear masks as they walk down Main Street or any public setting. But what I am saying is that when we come into enclosed areas where you cannot maintain social distance of 2 meters, then it's reasonable for you to wear a mask to protect your neighbour and the other customers. But that has to be supported by hand washing, and that's exactly what is happening in the GHA today, that people are being scanned for their temperature, they are being advised to use the gel that's available, and are given a mask, which they then take off and dispose. Because remember, if you wear a mask, it collects the environmental germs that are around it, and that potentially means that when you touch the mask, you contaminate your hands. So you have to be careful how you remove the mask. And again, as it is just a barrier, it doesn't need to be a high-class mask. And I know we're looking with civil contingencies to see how we can procure some supplies. But masks in themselves and fever scanners in themselves will not provide the necessary protection. So we're building in a huge amount of test, track and isolate services. So this is about providing screening and contact tracing. So what we are intending to do, and we're building that capacity up at the moment with some training, it takes a little while to train people and get them together and make it work efficiently, is that we will, once we've identified people, we will spend a huge amount of time trying to find out who they had been in contact with according to a separate case definition, and then we will provide for them support. Certainly, we're going to do a lot more swabbing. At the moment, I've just said, if you've got any symptoms, ring 111. I don't think we're doing enough swabbing. It's taken us an awful long time to collect the swabs that we have. We need to use them and use them wisely so that we can, if you like, driving in the dark, you switch your headlights on. The swabs and the results from those swabs are our headlights. It's important we have enough. So what we're also going to do is offer swabs to our frontline workers. We'll start with the government frontline workers, but I've absolutely no issue about extending that to other frontline workers such as home delivery services and supermarkets. But we really want to start with the Borders and Coast Guard Agency. We need to start with the RGP, the airline, AirJib. We also obviously need to target the GHA, the staff in that, particularly the ones that are in close contact with patients. The ERS, care agency, we're going to do some major we're going to do a sweep in the prison service because that's a contained unit where it could spread very rapidly. So you will see us out and about in a rolling programme of swabbing. And I should say that given the fact that teachers are also in a setting, we will include teachers in the swabbing programme. So that should mean that over a period of a few weeks, you'll be swabbed and you'll be swabbed again. And that's probably the best way we can provide for you that assurance that at that time you did not have the infection. And this, unfortunately, seems to be part of the difficulty is we've got a number of tests. The test that people are looking for is the magical test that tells you you've had the infection in the past. And you can sort of sigh of relief comes to the fore. Unfortunately, that test, and whilst people have tried to sell us those tests from Korea and China, the evidence is that those tests are unreliable and unsafe for us to use. So the only tests that we have are rapid polymerase chain reaction test. They're called rapid, but they're not that rapid as you may imagine. They can take up to 6 hours, depending on which type of test we use. Some give us a result in less time than that, but it's too long. And one of the things that we are waiting for is a new system, a radically new system, which my friend and colleague, Dr. Nicholas Cortez, has managed to procure in the NHS and develop, in fact, is the Optigene assay, which, if it works well, will give us a result in less than an hour, perhaps even half that time. That may radically change the way that we're able to provide people with results. I've always been available and I've gone out and spent a lot of time talking to people. I've spoken to teachers, I've spoken to the waste management services, I've spoken to lots of people in the GHA, I've gone and done video recordings for the police, for example. So I'm always available to go out to groups to explain, because obviously one of the biggest issues, as I've said, is the enemy often is fear, and we've got to empower ourselves with knowledge so that we don't fear it. So, and that includes speaking to you directly as I'm doing now. I would like for us just to think that even though we have not had a significant rise in the number of cases, that actually we've not been idle during that time. As the Minister has pointed out, we've been doing dry runs of seeing whether we can cope. Initially, the dry runs were with 1 or 2 cases, and now we're talking about 10 or 20 cases, just so that we can clean up some of the little irritations there are in the way that the system might work. But what we have done is we've spent a lot of time collecting PPE, the personal protective equipment. We've been building up a stock of swabs. We've been building up a stock of tests. We've increased our staffing, and we've increased the training of the staff. What we've really successfully done, which they haven't done in many other places, is we managed to protect our vulnerable, particularly our elderly. I think that's probably one of the single most important achievements we've done in the last 2.5 months or so. And I have to give acknowledgement, actually, because when I see my colleagues in other parts of the world, one of the reasons that we've made such a big difference is the amount of political support we've received. The political leadership on all parties has been stunning, that the level of understanding and obviously sometimes scrutiny has been really helpful, so that we've been able to move forward as a whole community in this endeavour, which was always going to be tough, and I believe will get a little bit tougher in the weeks and months ahead. Thank you.
Good afternoon. The first question is from the Olive Press for Minister Valvan. After Dr. Rawal said yesterday that some routine GHA services could now be rolled out over the next few weeks, could you give the public an idea of which ones could be reintroduced first, or is this still being discussed?
Well, this at the moment is still a work in progress. We are presently looking at our schemes and see how we will roll this out. But we have already had a few ideas coming back. Our clinical teams are working very, very hard to see how best to do this. But we will definitely be looking at our waiting lists and seeing which of those patients in the wait list are most in need of being seen to. And then over weeks we will be developing, most importantly, screening. So go back to screening people, mammography, cervical screening, and cancer, for example, colon cancer. That is the way we're looking at as we move on. But as I said, it's still work in progress, and we'll be informing people once we are sure of that scheme.
The next question is also from the Olive Press for Dr. Bharti. Is it viable that the antibody test to be rolled out across 25,000 homes in the UK could also be introduced in Gibraltar in the near future?
So as I said, there are various kinds of antibody tests. Some of this is linked to the kind of immune response that we have, and the immune system is quite complex. there's innate immunity, there's cellular immunity, and there's humoral or protein-based immunity. The antibody test is the protein-based immunity, and at the moment it's quite perplexing, and certainly laboratories across the world are finding a variable response to in people to the antibody test. Some places, some people have a very strong response, other people don't, and the people that have the disease the least, in other words, the asymptomatic people, have the least response on the antibody test. So there's an awful lot of debate and discussion about which test is appropriate. We think, and the advice we've received is there's a new test, which is an ELISA test, that may be much more functional than the other tests, which are more like pregnancy tests where you do a pinprick. The ELISA test actually will require more blood to be able to do it, and we're actively looking at that test. And if it is appropriate and suitable, then we will go out and get them in bulk so that we can help identify people who may be exposed or have been exposed to the virus. But I would point out the evidence at the moment seems to be the major way that this is resisted by most people. I'm not talking about the really ill people in hospital, but most people are not really ill in this case. It seems to be a cellular immunity, and this cellular immunity, which is the cells in your body in the lungs attack it directly, the virus and the harmed, the adversely damaged cells that exist, is that the immunity for that has a very limited memory. It may only last, that memory may only last 6 to 12 months, which is actually the principal reason why the cold comes back every year.
The next question is from the Chronicle, also for Dr. Bharti. From the outset, you have maintained that Gibraltar will be hit hard by the virus, that most of us will get it, and that it's likely that people will die. Your position has remained unchanged despite the thankfully low numbers of positive cases here. What factors and indicators, both here and elsewhere, would give you the confidence to revise your expectations? What are you looking out for?
The reason I've remained steadfast is that there were certain factors that were very clear based on my experience that would indicate that Gibraltar was particularly susceptible. We did have a measles outbreak here some years ago, and the rate of spread was beyond what normal countries or communities would have, and that was a manifestation of the fact that we live densely, and we not just live in a congested place, but we live very intensely together, so that we share our relationships. We're doing kissing and hugging and all the things I've said in the past. And what we have done is we have stamped out the current level of infection by enforcing lockdown. We've essentially stamped on it because we've stopped the kissing, the hugging, the handshaking, we've introduced hand washing, and we've essentially, as a community, succeeded in driving down this coronavirus by not moving about as much as we did. Now, the big issue for us is even if we manage to remove it, let's say I had a magic wand and I managed to say there is no coronavirus here. That's not true, in fact. We do have the COVID-19 is present here. But let's, for argument's sake, say that we did. But it's across the border. It's in London. It's in Africa. Wherever we go, and we've got ships that come here, we've got planes that come here, we've got thousands of people that cross the frontier. So we will continue, as long as the world has it, we will continue to be vulnerable and susceptible. According to our research, only about 4 or 5% of the population have any evidence of having had the virus. So even if we'd cleaned it out, if 95% of the population is still not is naive to the virus, it's never come across it before, the level of immunity means that we remain susceptible. So I would say that we need to look out to our borders, whether it's by air, by sea, or by land, and that to a large extent will drive what happens in Gibraltar. So I cannot tell you, I've used this analogy before, but if we're a dry bush right next to a forest fire, I wouldn't feel particularly secure that that forest fire wouldn't throw sparks into that bush. And, you know, we can, certainly, it's not practical for us to put a barrier across some, just the frontier with Spain, because our staff and many of our essential services are delivered through Spanish workers. So we've got to address the world as it is, not the way we would like it. And that means that the only way that we're going to try to manage this is do a seek and destroy mission. Whenever we find it, we'll try to seek it out and try to stamp it out individually and their contacts. And that's the only way that I think we can find our way out of the lockdown, but also means that actually it's the only way for us going forward to survive in an environment where the rest of the world's infected and infective.
The next question is also for you, Dr. Bharti, from the Panorama. Can you explain what you mean in your recent online tweet that, quote, the most dangerous times are ahead, close quote, and just how bad is it going to get when in the same tweet you dramatically say you had a lump in your throat and are worried?
I think I've just answered that question as to why I said what I did say. And in some ways, I'm just clarifying and putting in a different way what the Chief Minister has already said in these conferences in the past, which is that the issue is not that we have succeeded or not succeeded, it's that we live in an environment where the virus is still there. It's still there. We still haven't got large volumes in Andalusia. We've heard and seen what's happened in Madrid. We've heard and seen what's happened in Milan, what's happening in other parts of the world. The virus is still there. So I think the problem is that when we do loosen the lockdown, we also, and remember the lockdown has been the bit that's been responsible for stamping out the curve, that may just be enough of a spark, or the next spark that lands on this lovely tree that is Gibraltar, it would catch fire. That's why I have a lump in this throat.
Again, from the Panorama for Dr. Bharti, the government policy to combat COVID-19 should be guided by science, but ultimately it is a political decision. Have all your recommendations and advice to the government since the onset been taken on board, or are you disappointed, if not annoyed, that not all your advice has been implemented or applied?
I cannot think of a recommendation I've made that hasn't been reflected on and thought through and debated. And I've sat in meetings where I've been, I would hesitate to say cross-examined, but actually effectively spoke between ministers of the government and the opposition about what our line of thinking is, what the evidence is, and where we intend to go. So I think I paid tribute to the politicians. I think Gibraltar's really lucky to have the quality of the politicians it does have. And that's shown in the fact that people put the interests of Gibraltar ahead of their own petty political interests. And they've stood in front of us and said exactly that. And I would bear that out. So as far as scientific advice and medical and clinical advice, public health advice, I've not got any reason to complain. I think it's just praise, actually.
A question from YGTV for Dr. Bharti. Is there still hope that the coronavirus will turn out to be seasonal, and that there will be a significant drop in cases over the summer? What is the latest research you have regarding this? So
it appears that there probably isn't a seasonality around this. I think people were hoping, because coronaviruses, the other 4 coronaviruses deplete themselves in the summer and they come back in the winter. And I think I have explained that in even hot countries, it's not in any way diminished. That if you're in Singapore, it can be quite wild it was in Hong Kong, but they've managed to batten down in terms of their interventions. So in a lot of hot countries, you do find that it's spreading rapidly. Environmentally, this virus is not that strong. That's why I've always emphasized that using simple household bleach, diluted, even disinfectants will do the trick. So it's not a robust virus, but the reason it spreads is not from the environment itself. It is from the coughing and the spluttering. That means that the 2 meter distance, that's why the 2 meter distance exists, is because the droplets really don't go more than 2 meters. So I would say that much as I would love to believe that it was seasonal and we'd get a break, I don't believe that to be the case.
The next question is also from YGTV for Dr. Barty. You tweeted that it was important to allow the elderly to go out to exercise and this would help them prevent other medical conditions in the future. Although the rest of us have been able to exercise, we have essentially been told to spend most of our days indoors. What sort of toll will this take on our physical and mental well-being in the long run?
And that's $1 million question. We do know that human beings are social creatures. We love and need human company. We love and need touch. It's self-curative. We need and take attention and we groom ourselves, which is paradoxically why people feel the loss of hairdressers so much. The issue, unfortunately, is that I think I've lost the thread. Can you read that again?
What sort of toll will this take on our physical and mental well-being?
Yes, that's right. I can get distracted when I'm talking about those here particularly. The toll, obviously the issue is around the fact that our cardiovascular system needs exercise to be able to work. And the best way is to have controlled levels of exercise that where we achieve a certain proportion of our maximum heart rate and our ideal heart rate. There are web applications. It's dependent on age as to what your maximum heart rate is, but you should have about 2 hours of exercise in a week. That's what the recommendations are. And what we've had to balance is the risk of the infection, the way that society interacts, and the risk of adverse outcomes. Now, for the elderly particularly, there are particular issues around loss of muscle mass. If you don't use your muscles, unfortunately, the old adage, if you don't use it, you lose it, is much more valid for the elderly. So if you don't use your muscles, you lose your muscles. If you don't stress your bones become weaker. If you don't use your heart and your lungs, then your capacity declines more. So on balance, it's a really difficult choice, but on balance, we think that the elderly have been, and senior citizens have been not exercising for long enough that maybe we've got to the point where the harm from not going out and taking a little bit of exercise is overbalances the protection from COVID. But I would say that it's a very fine judgment. So that's why if older people do go out to exercise, and actually older people can go out to for medical care, for example, that they avoid crowds, they avoid hugging and using that as an excuse to visit the grandchildren and to socialise. It should really be about exercise first and foremost. I think that's why I've got lumps in my throat. It's really difficult when you've not seen anyone and you've been trapped in your home, not to visit old friends or meet up with old friends, but really you need to keep the safe distance. This is about balancing the risk of catching COVID against the risk of you having a heart attack or breaking a limb through a fracture because you've tripped and fallen.
And that's why I've actually mentioned myself the importance of exercise at home. It's not ideal that we're in a confined area, but there are things that can be done. And just that little bit of exercise that one can do at home by way of using maybe some online sort of program, or just like jogging on the spot, walking stop, touching your toes, doing some Pilates, some yoga, anything that can be done, will definitely help. It's not ideal, but it's striking that right balance. So while we're locked up, try our best to be active, to eat healthily, to be as fit as possible so we don't gain weight. And once we slowly release that lockdown, then obviously people who are inclined to can go out and can do that exercise, walking, which is extremely good way of getting the heart working and pumping, and that will help protect us as well.
The next question is from the Chronicle for Dr. Barty. We've seen a handful of cases over the past 2 days, but there was a period of 7 days prior to that without new positive cases. What explains that gap of a week without new cases? What, if anything, does that gap tell us?
I think what the gap tells us is that we not just reduced the curve, we flattened the curve for that particular outbreak. And that what we're in a position now where we will get sporadic incursions across from air, by sea, by land. And the difficulties I've said before is we're not always able to define who it will be, and our essential services are dependent on people who don't always live here. So I think the gap just means that we've gone through a fallow patch, and potentially it could pick up again. And in fact, we've got 2 or 3 cases, and I'm hearing that there may be more cases to report tomorrow. So we mustn't be complacent. We mustn't be complacent.
And the last question is from GBC. GBC understands that there may have been at least 1 positive case at social services. Can the government comment? And if this is accurate, what contact tracing and target swabbing will follow?
This is something that we're going to start doing in earnest now. Once we discover positives, we will be doing contact tracing to see whether we can trace everyone that person's been in contact. This will form a very important part of the work we'll be doing in the future. So, I mean, it is quite normal because many of our staff will come across the frontier. There is that inherent risk that we will keep. We will keep the risk there of positive cases coming through undetected. But the next phase now, we will be contact tracing from now on.
So I had a word with the director yesterday about this, and obviously there was a lot of concern. However, it appears that the envelopes with the money in them had been prepared, and the evidence for the virus being able to survive in that setting is limited, and in fact these things won't be distributed till I think Wednesday, so there's little chance of the virus being on the paper and the envelopes. But I would beseech people to move over to having an electronic bank, and to take currency electronically. You cannot catch virus from electronic currency. And I know a lot of our senior citizens find this a strange topic. They like the actual feel and the substantiveness of holding cash in their hands. But remember, there's always this potential that the virus may be on what we call a fomite, what we call a vehicle that can be transferring the virus. So if this is the moment you were teetering over whether you should open an account and deal with money electronically, I'm sure that civil contingencies will put in place ways to help you improve your learning and knowledge about this. But the advice I gave to DSS, coming back to that, was that the person we identified was self-isolating, and that actually the most important way that people could protect themselves was to wash their hands. And if they washed their hands, they would remain safe. And if they had any symptoms, they would let us know. It isn't an easy task to set up contact tracing, so we're working hard to make that happen. I hope that the contact tracing cell that will be active, which is going to be linked to the 111 service as it happens, will be active in a few days, But obviously we have to bring people in, we have to train them, we have to get the software, we then have to practice, and then we will get it right.
Okay, now the last question from GBC for both Dr. Bharti and Minister Balvan. Given that swabbing can yield false negatives, to what extent are CT scans being used as a complementary diagnostic tool? Who carries these out, and have steps been taken to ensure GHA benefits from the clinical experience with this virus built up by practitioners elsewhere, in particular the UK?
Yeah, so actually there is no perfect test, and every test we have has a false negative. Technical term is we look for sensitivity and specificity, and the issue of CT scanning is that it isn't as sensitive as we would like. It's certain, but it's certainly not specific. In other words, any viral illness such as flu gives you the same kind of appearances on a chest X-ray, or a CT scan. So if you just looked at the CT scan, all you could say is this person has a viral illness, not that this person has coronavirus. Likewise, the polymerase chain reaction test that we have, which is the best that is possible, it's developed by Public Health England, still has a chance. The term false negative means that it sometimes tells you that you're negative when it should be positive. There are a number of factors in that. One is the swabbing technique that you have is important. Another one is where you swab. And thirdly, the kind of technique that you use. And we've got 4 different assays. So actually, one of the things we've done, and we have done with people that we've had very strong sense that they will be positive because their symptoms demonstrate it, is we've used 2 different tests that we have to work on the basis that there's a complementarity between the 2. We haven't routinely used CT scanning because, of course, CT scanning, a chest CT scan, gives you the same radiation dose as about 100 chest X-rays, maybe 80 now. So it's not something that we would do because there's a cost attached to it, unless there was a good reason to do it and it would change our clinical management. So we actually treat people on the basis of the symptoms they have, not what their chest X-ray shows or what the test shows. Because if you're short of breath, you need oxygen. It doesn't matter what the test shows.
Okay, thank you.
Okay, just like to say thank you very much for watching today. Stay safe and have a good afternoon. Thank you.